Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. There are several methods to obtain information in research studies. The first is physiologic measures, including biophysical measurements such as pulse, blood pressure, lung sounds, etc., and biochemical measurements which include, for example, laboratory values. Physiologic information can also be obtained by observational means and self-report. A second method includes observational methods, including unstructured and structured inspection or observations. Another method is the structured interview. This method mandates very careful attention to the design of a standard interview schedule. Interviews require pilot testing, training of interviewers, recording of data, interview techniques such as probing, and meticulous management of interview data once all interviews are complete. Two other very commonly employed methods of measurement include the questionnaire and the scale, both self-report methods. Questionnaires have less opportunity for bias than the interview. However, they require careful selection of items to identify the information to be obtained. A questionnaire content map or blueprint must be developed in order to represent the domain of interest in the study. A scale is a more precise means of measuring a phenomenon of interest in a study. In most scales, the items are summed to obtain a single score. These are summated scales. Less error variance exists when a total score on a scale is used in data analysis. There are several types of scales commonly used in practice. A rating scale lists an ordered series of categories of a variable that are assumed to be based on an underlying continuum. Scores on rating scales are treated as continuous variables, and thus parametric statistics can be employed with these scores. A popular rating scale used in pediatrics is the Wong-Baker Pain Rating Scale, which employs a scale with 6 individual ratings from no hurt to hurts worst. A Likert rating scale determines the opinions or attitudes of a subject and includes a declarative sentence with a scale after each statement. For example, a popular scale includes declarative sentences with the following response choices: strongly disagree, disagree, undecided, agree, and strongly agree. Each response is given a numerical value, and an overall score is obtained on the rating scale by summing the items. The semantic differential scale was originally developed to measure attitudes or beliefs. It is now used to also measure variations in views of a concept. This scale includes 2 opposite adjectives with a 7-point scale between them. The subject chooses the point on the scale that best describes his or her view of the concept explored. The visual analog scale measures magnitude, strength, and intensity of a subject's sensations or feelings on a concept under investigation. The visual analog scale to measure pain distress is illustrated on this slide. Two additional measurement methods include the Q-sort methodology and the Delphi technique. The Q-sort technique is a comparative rating that preserves the subjective point of view of an individual. This technique involves sorting cards with printed phrases on them to categorize the importance placed on these various words or phrases. It can be used to develop a scale. The Delphi technique measures the judgments of a group of experts for the purposes of making decisions, or assessing priorities, or making forecasts. There are several types of Delphi techniques. Ultimately, the purpose of this strategy in classic Delphi is to reach consensus. Diaries record events over time by an individual to document experiences, feelings, or behavioral patterns. Nurse researchers and clinicians often use food diaries, for example, in weight management and diabetes education programs. The electronic medical record is a database that is increasingly used for generating evidence for practice. Statewide and federal databases with aggregate data can be used to investigate outcomes, cost, and quality. Such data used without personal health identifiers are a rich source of information that can be analyzed and trended. Evaluating a research test or instrument for use in a study requires careful consideration of the following questions. 1. Does the instrument measure what you want to measure? 2. Does the instrument reflect your conceptual definition of the variable? 3. Is the instrument well constructed with solid reliability and validity data? 4. Does your population resemble populations previously studied with this instrument? That is, the normative sample. To continue. 5. Is the readability level of the instrument appropriate for your population? 6. How sensitive is the instrument in detecting small differences in the phenomenon you want to measure? That is, what is the effect size? 7. What is the process for obtaining, administering, and scoring the instrument? Are there costs associated with the instrument? To continue. 8. What skills are required to administer the instrument? Do you need training or a particular credential to administer the instrument? 9. How are the scores interpreted? 10. What is the time commitment of the study participants and researcher for administration of the instrument? And finally, 11. What evidence is available related to the reliability and validity of the instrument? Readability of an instrument is critical to assess prior to the conduct of a study. One formula commonly used to determine readability is the Fogg formula, present on this slide. A pilot study using the instrument selected is invaluable in ascertaining the face validity and readability of a research instrument. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.